Hello, and welcome back to our second podcast, but I guess this is our fourth episode of vlog, podcast, whatever you want to call it. So I'm Fran. I'm one of the infection control nurses.
Hi everyone, welcome back. I am Jen. Thanks for listening.
So we are going to have, I don't know what we call it, a bit of a mishmash episode today. Jen called it an airy-fairy episode, so we're going to call it that. We've got a couple of things we're going to just have a quick chat about today, just run over. So Jen, what are we going to start off by talking about?
So one of the key things that can be quite difficult to achieve in IPC when you consider like all of the PPE and stuff that we're asking people to wear is sustainability. Obviously, it's something that we need to try to consider as much as possible, whilst also trying to ensure that the PPE we use is being used appropriately and safely. So one of the areas in which we're trying to look at this is we have a system-wide sustainability approach with IPC. And so we're linking in with the IPC lead for GP practices, the IPC lead for care homes and domiciliary care, and ourselves as the acute team. And we're looking at things, specifically looking at sort of how we can help to reduce inappropriate glove use, because we know this is a problem, not just within hospitals, but from a whole system-wide approach. And we are getting some help from the lovely Human Factors team, hopefully. And we were going to link in with the Green Council, just looking at ways that we can help to sort of change mindsets and culture around why people wear gloves. And like, I don't know about you, Fran, but I think sometimes people see them as like a bit of a superhero barrier to infections.
Yeah, exactly. It's really difficult because obviously I get it totally. I mean, I suppose, you don't necessarily know, what someone's touched or, what's on their skin or anything like that. But I think the way I thought of it the other day, I was discussing with one of our colleagues, was thinking like, if you were, looking after one of your relatives, would you put on a pair of gloves to help wash one of your relatives? I don't think I would, but I understand the reasons behind it. But it's just something we're just trying to really discourage because, hand washing is obviously, as we know, very effective. So there shouldn't really be a need to use gloves necessarily in, personal care, washing somebody's top half, their
for
hair,
instance,
their face. It's just not necessary, and you can use your hand hygiene to replace it. So
obviously, if someone's got any like severe skin conditions or open sores or wounds, then obviously in that case that is completely understandable. And if you're helping them with any sort of any personal care,
feeding.
Oh my goodness, you see that quite a lot, don't you? Actually,
Definitely.
And it's really impersonal. Like, I mean, I wonder, patients must sort of think that we think they're dirty.
I know. I think sometimes, when you I don't know, just as an example, when I've been round to somebody who's got an MRSA on their nose and groin swab before, I was wearing, for contact precautions, wearing gloves and the apron, and they were like, "Oh, I feel dirty. I feel like I've picked this up and it's my fault and everything." Obviously, that was, they had an infection, but I think that it just kind of sums up the general.
Yeah, it kind of has that connotation, doesn't it?
Yeah, exactly. So I think it's, I always go back to the image. I don't know if you do, like of somebody holding their patient's hand and they've got a glove on them, one holding them without. I think, would you rather feel someone's actual touch of their skin if you're, end of life, or, you don't want to see somebody all sort of gowned up unless you have to. But yeah, it's
difficult.
Personal.
I think sometimes it's difficult to know like where to draw that line. But if you ever need any sort of like help with where do we draw that line, we can always do like some scenario-based questions, scenario-based activities with yourself, with your members of staff in your departments. Definitely. To help sort of, cut through any of those barriers that can make it a little bit difficult to risk assess that decision of do I need gloves or do I not. I mean, it can just from a sustainability factor, obviously we want people to use less gloves because it's then it has the impact of less waste and less cost incurred because of less product being used. But I mean, like, Fran, you have quite bad eczema, don't you? And I
Yeah.
mean, do gloves, like, do they damage your skin on your hands?
Yeah, I don't know if anybody that's got contact dermatitis, eczema, you know what I mean. It's just, wearing gloves, it is uncomfortable if you've got them on for a long time, and they shouldn't be on for a long time anyway, unless you really have to. But I know with myself, under gloves, it gets, quite hot, and it gets, itchy, and it's uncomfortable, and it's just not necessary. And although, again, anybody experiences eczema, with hand washing, sometimes it's not the most comfortable, but as long as you've got a good moisturiser afterwards, it's, that's your best option, because you then feel really clean, and you feel, you've used the best method to decontaminate your hands in whichever way, whether that be with soap and water or with hand gel, and then using a moisturiser afterwards. I mean, I find that really helps. So, yeah, gloves definitely are an irritant.
And I think you could like consider, do I need gloves in this instance, or actually would it just be better to decontaminate my hands before whatever activity it is you're doing, and then again afterwards? You may not need to use gloves at all in that instance.
I think it's like, although we obviously are all very time pressured, it is about taking, I know everyone's probably heard this a billion times, but it is about taking the step back and thinking, actually, in this situation, what am I doing? I am giving a patient a spoonful of yogurt. Do I need gloves to, it's just taking just a second or two just to really consider it. Is there any risk there? Obviously, if there is, you would hopefully know about it at that point, and then you would use the appropriate precautions. But otherwise, just taking a second, having a think, and, thinking about what the patient would like as well, just for their own experience, really, whilst being in hospital is going to be the nicest for them, really.
Yeah. So we will have like a glove awareness week, and that tends to be in the week before World Hand Hygiene Day, which this year is on the 5th of May. So we'll be around and about. We'll be bringing you bits and bobs. We'll be trying to sort of really push the very well-known topic that we love to discuss of hand hygiene. And if you ever need any help with, some of the products, for instance, might be irritating your skin, or you're really struggling with contact dermatitis or with eczema, you can reach out to us, reach out to Working Well. I think some of the products used aren't always that effective. And if you are finding that, please let us know, because we can sometimes get hold of some different products that might be able to help your skin a bit better.
Yeah, definitely. And also, just as another thing, if you have a sort of catch up with your manager every month, there should also be a hand surveillance in that as well.
Yeah.
And just another thing, again, to just tag on to the end of that, the RCN do have a really, really helpful platform. I actually only found it the other day, but it's actually for hand health. And there are like loads of different activities you can do to kind of promote that. So that's definitely something worth checking out. I'm sure if anybody's interested, you can just give us a shout somehow, email, call, and I can find a link from somewhere. I did find it the other day. But I think there's sustainability, obviously, with all of that. It leads on really nicely into, the glove awareness and the WHO-led initiative, World Hand Hygiene Day kind of topic, which only being next month is something that we can really start considering. It is a big focus for us. So we're going to try and focus on it a little bit more and see what we can do. Hopefully bring out some resources, as Jen said, maybe a few goodies. I don't know. We'll see what we've got in the office. So that's what we're going to be looking at.
We will give you bonus prizes, bonus stickers. We will find some bonus sweets.
We've got
Please
stuff.
take off your watches. Please, please, please. We are so badly struggling with all of those fundamentals that we all seem to have like pretty much nailed pre-COVID.
Yes.
And I don't know what has happened since, but I walk around and everyone is wearing a watch.
Yeah.
And like, I would not want to be wearing my watch in work.
No.
Like with all the stuff that you could potentially get on it.
Yeah.
And then you're wearing it home.
Yeah.
You can't, even if it's waterproof, you're not going to be washing it every time you wash your hands.
Yeah.
And we know full well that you can't wash your lower wrists properly when you've got a watch on. So please, please, please take them off.
Please.
And we will happily bribe you to do so.
Yeah, again, leading on very nicely to our, bare below the elbows. It's part of our uniform policy. Again, we see a lot of nails. We see a lot of rings, studded rings. And of course, it's fine to wear a plain wedding band. Don't know what you call them. Wedding band.
Yeah.
So nothing with stones in, because I think, again, it's taking that second to step back and think, okay, so I'm wearing this ring with a stone in, or I've got
I want
long
poo
nails.
in my engagement ring?
Exactly. There are so many bugs, bacteria, or just organisms in general that you just don't see living around the corners of your nails, living under the stones in your rings, living in all the little nooks and crannies everywhere. And that's why we're so kind of really, really for it on wanting to.
It's gross, guys.
Yeah, it really, it really is. Even so, I wanted to make a video. I wanted to try and, I don't know if anybody's seen our glow boxes before, of where all the bacteria,
where all the bugs can
exactly
gather. Yeah.
Yeah.
It's always around the nails
Yeah.
and around the thumbs, isn't it?
Exactly.
We do have a beautiful machine that really belongs to one of our senior IPCNs, Geraldine. It's kind of her baby.
Yeah.
It's called the Shore Wash, and it's like it's like an interactive, computer-generated hand washing tool, and it's really good. We'll get Geraldine to bring it out around Hand Hygiene Week, and it's quite a good way. You'll soon be able to do some of your.
You put your smart card in, and then it tracks how you wash your hands effectively. So
that's it.
That's definitely going to be a really good tool. But
and it'll end up being used as a sort of CPD activity, which will be quite good.
Yeah, and I think, because we want to focus on this, because again we're obviously known as infection control to a lot of people, of course, and we do call ourselves that, but we're also infection prevention and control. I know we said we were infection control nurses, we're infection prevention and control nurses. So what we're wanting
prevention comes first, guys.
Exactly. If we've got all of the prevention down, we don't need the control necessarily. I mean, we do, but so in terms of our prevention work, we're really trying to get back to it after such a difficult period. And I know, again, every vlog, every podcast, you'll hear us go, oh, it's been a difficult period, COVID, but it's true. So we really want to try and get back to doing some of that preventative work. So anything we can do to help, anything you feel that is, in your areas that could be highlighted, teaching on. I know we've said that we can come and do some teaching,
definitely.
little ward sessions.
And I mean, even if there's anything that you think, I don't agree with that, that is so completely fine.
Yeah.
Let's talk about it, because
exactly.
and see if we can come to a mutual understanding.
Yeah. No, we're not gonna shoot you down at all. We love to hear, opinions from everybody, because it really helps to form, what we're working on.
Yeah, and a sort of an all-rounded evidence-based opinion, which is what we're sort of all working to anyway, isn't it?
Because we don't want to be seeing these people that come round and, we're not these people that come round and just try and really strictly enforce everything. We want to hear what you have to say.
Yeah.
So just bring it to us.
Yeah.
We will. But yeah, as I said, we can pop round, we can bring the glow box. When the Shore Wash is up and running, we can bring the Shore Wash. If you want to get involved, we can
give us a shout.
We've got a lot of things going on, bubbling away into the surface.
We're going to have a couple of new IPCNs joining us soon. But this is being recorded in March, so by the time this comes out, the job will have closed.
Yes.
But so we'll have a couple of new team members by the time this comes out, which will be exciting.
Yes.
And I think one final thing we just wanted to mention is a little bit off topic of what we have been discussing is. So one of our companies that provide us with a lot of our cleaning equipment and cleaning wipes is Gamma, and we had Amy on our first podcast from Gamma, but they provide waterless bathing options. So there's these bed bathing wipes, and there's also shower caps. They can be kept in a warming cabinet that can be put onto your ward. Some areas are trialling it at the moment. So Wrencombe Ward and Lilybrook Ward in Cheltenham are trialling them at the moment, and they seem to be going down really well. I think it's a nice way, particularly for maybe perhaps bedbound patients, to have that feeling of feeling a bit fresher, a bit cleaner, and being able to have like a nice hair wash, basically from the comfort of your bed.
Yeah.
So if it's something that you feel like your department might benefit from, say, DCC, for instance, if you guys are interested, give us a shout. Anywhere else who has a particular interest in it, just give us a shout because Clinell are happy to help facilitate any trials.
Yeah, they're very moisturising. They're very nice.
Yeah,
and
they do feel really nice, actually.
They're really
they
nice,
leave your skin
actually.
feeling like quite fresh and not like tacky or anything. They are very nice.
I mean, yeah, I love them. I mean, it's nice. It's also nice something to freshen up your hands as well.
Yeah.
Not that they're necessarily used for that, but that's always nice as well. So, I think I know that's been a bit of an all over the shop kind of
whistle-stop tour of what is in Jen and Fran's heads right now.
Right this very second, this is what is on our piece of paper. This is what is going round
in our brains.
So
we're going to draw it to a close.
So that is everything from us today. So if you, again, as per, if you wanted to get in contact with us, you can get in contact with us via our group email on the Global, or our contact numbers, extension 6122 for Gloucester and extension 3129 for Cheltenham. Any questions, any queries, just
any
come to
topics
us.
that you would like in future
Exactly.
editions, give us a
We're
shout.
always looking for ideas.
If not, we will hope to see you next time.
Yes.
Thanks very much for listening.
Thank you, guys. See you next time.
Bye.
Bye.